All right. Good morning, everyone. This morning, I woke up to the same news as everybody watching and everybody across America that the FDA and the CDC had recommended a pause on the use of the Johnson & Johnson vaccine. We are agreeing to that pause, as is, to my understanding, every other state across the nation. I, like others, watched the CDC's update, and then I just got off the phone with the governor's meeting with Jeff Zients, who is the White House's head COVID-19 coordinator, Javier Becerra, U.S. Department of Health and Human Services Secretary, Dr. Walensky, the CDC director, Dr. Fauci, the Surgeon General, and others. Here is what we know. There have been 6.8 million overall doses, vaccines of Johnson & Johnson that have been administered in the United States. 6 individuals have developed blood clots from that 6.8 million. Each of those individuals was a woman between 18 and 48 years old. And when they started the onset of symptoms, when this developed, was between 6 and 13 days for each of them. We were told that we should expect this pause to be days to possibly a week, but that it is likely not to be longer than that. And they believe that they will find the Johnson & Johnson vaccine to be safe to administer in the future. The pause, we were told, is for 2 major reasons. Number one, to determine how many cases are truly out there. If there are more than just 6, certainly with AstraZeneca, more were found at the time of the pause. The second, and Dr. Stack may talk about this a little further, is the importance of educating our medical providers on the appropriate treatment for these clots, because it is different than the treatment you would normally do in a blood clot situation. So, at least in their reasoning, without the pause, the chance to execute people who have this reaction could potentially get the wrong type of treatment, which could harm them further. At least one of those 6 individuals, we believe, has passed away as well. Obviously, this isn't good news, but it is also not crippling news for our vaccination efforts. Kentucky has received very little Johnson & Johnson, as has the country, in terms of overall vaccination programs. It has mainly been used in Kentucky with independent pharmacies or in our corrections institutions to reach difficult-to-reach populations, and some other areas across the state in our regular programs. To my knowledge, we have not seen any side effects like this clotting in Kentucky. Kentucky right now has lots of Pfizer and Moderna vaccines, meaning anybody out there who has a J&J appointment in the next couple days, when that's going to have to be canceled, it cannot be administered in the next couple days, can sign up in their area and should be able to get in even this week for their first dose of Pfizer or Moderna. Remember, millions upon millions of people have received those vaccines. They are highly safe. In fact, Pfizer in the field is proving more than the 90+% effective it was in the trials. It is significantly decreasing death and illness across Kentucky, as is that Moderna vaccine. We need people, absolutely need you, to get that Pfizer and Moderna vaccine so that we can hit our 2.5 million adult goal of vaccinations in Kentucky, but also so we can get towards herd immunity. Now, both Dr. Fauci and Dr. Walensky did put this into context, and this is important if you've gotten this vaccine, and also how to look at the risk and whether or not you should get another vaccine. So thus far, from what they've seen, you have less than a 1 in 1 million chance of developing these clots if you've gotten the J&J vaccine. Less than 1 in a million. So if you've gotten the vaccine, there's likely no reason to worry. If you're less than 2 weeks, just watch for certain signs that, again, Dr. Stack will talk about. But that less than 1 in 1 million, That when you compare it to your risk, not of just of getting COVID, but of dying of COVID. If you look at the deaths we've had in the United States versus the overall population, it's 1 in 558. So again, just basic math. Right now, you have less than a 1 in 1 million chance for getting these clots if you get the J&J vaccine, while you have a 1 in 558 chance. And again, those odds aren't moving in our favor of dying of COVID. So get a vaccine. Incredibly important during this period of time, and we cannot let this slow us down, and it shouldn't slow us down. The United States, between the pharmacy program and what's directly coming to states, is going to get about 1.85 million more doses of Pfizer and Moderna this week. We ought to be able to make up any loss of appointments from J&J through the use of Pfizer and Moderna. So if we can, in many ways, step back to the very beginning of this pandemic, stay calm. It looks like the risk here is very, very small versus the really significant risk of being harmed by COVID. They're being careful. They want to make sure they can treat anyone who has a side effect because of this vaccine. But we even believe that the Johnson & Johnson vaccine is likely to be up and running and maybe directed at a different population, but still back in the fold soon. Meanwhile, you have two incredible vaccines out there that can help us defeat this virus. With that, I'm going to turn it over to Dr. Stack, and then we'll come back. And I know we've got a lot of questions, a lot of journalists on the line, and some written questions too. We'll do our best, all of us being patient to get through what we can, and then knowing what we know. Obviously, this being something that we only learned about this morning when we woke up, just like y'all, but we're going to make it.
Good afternoon, everyone. Thank you, Governor. So as the governor has already shared, early this morning, the CDC and FDA issued a joint statement concerning 6 reported cases of cerebral venous sinus thrombosis combined with low platelet counts that had occurred in women between the ages of 18 and 48 years of age who received the Johnson & Johnson COVID-19 vaccination. This is a rare condition that is a type of blood clot for which the treatment varies from other types of blood clots. Importantly, it's also exceedingly rare in the population of people who have received the J&J vaccine. In fact, only 6 people out of 6.8 million people who have received J&J in the United States have been found to have this condition at this time, as of yesterday, April 12th. The CDC is convening a meeting of its Advisory Committee on Immunization Practices tomorrow, and the FDA is also conducting its own analysis of the data. Until these analyses have been completed, the FDA has advised that J&J COVID-19 vaccine administrations be paused. This morning, I have communicated this message to vaccine administration sites throughout the Commonwealth of Kentucky. It is important that the FDA and CDC safety reviews occur and that we await further information from these experts before we reach additional conclusions. That this concern has been identified in as few as 6 people out of more than 6.8 million people vaccinated should be a reassuring sign that the safety surveillance systems in place are operating as intended. While this process unfolds, people who have received the J&J vaccine who develop a severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination with J&J should contact their healthcare provider. It's important to note that this will continue to evolve, but all the individuals who have been identified so far have been identified within 2 weeks of receiving the J&J vaccine. And if you are more than 4 weeks out, it is incredibly unlikely you'll have this problem. So you should be further reassured if that's the case. As of yesterday, more than 120 million Americans have received at least 1 dose of either the Pfizer BioNTech, Moderna, or J&J vaccine with a remarkable safety profile. Further, the vast majority of these vaccinations have been provided with Pfizer BioNTech or Moderna, neither of which have shown any sign of this concern. It's important to remain mindful that COVID-19 is a dangerous disease that in just a single year has taken the lives of nearly 3 million people worldwide, approximately 560,000 Americans, and more than 6,200 Kentuckians. Safe and effective vaccines are a critical tool to protecting our people and putting this pandemic behind us. We remain committed to keeping you informed and updated as the situation evolves. And again, the governor has already shared very compelling statistics that show that the relative risk of harm from COVID enormously outweighs the risk of any potential harm from a vaccine. But we're committed to giving you information as quickly and as accurately as you receive it. And I continue to encourage all Kentuckians to please continue to seek vaccination so we can put COVID behind us. Over the next few days, J&J will be paused. And remember, whenever you receive a medication, you should always be able to ask the clinician offering it to you what it is, and your vaccination card will show what it is. So there should be no uncertainty before you receive a vaccine what you are receiving, nor should there be afterwards what you received, because your documentation will show that very clearly. If you have any more questions, we'll be available. Thank you.
So after a year and a couple months, we know that this virus isn't easy to beat, but we are still on the path to do it. But we've got to draw from those lessons that we learned early on, that we got to remain strong, we got to remain calm. Now more than ever, we know what to do to defeat this virus. We just got to get vaccinated. We have plenty of safe alternatives out there. I believe ultimately J&J will be deemed a safe alternative for a portion of the population. We've just got to get it done. We've come too far. So let's make sure, again, that we're smart about this, that we're calm about this, and that we ultimately push through it, just like we have so many curveballs from a virus we didn't have testing for, to a lack of PPE manufactured domestically. We've overcome all those challenges. We can do this too. All right. Let's see. I've got a couple of written questions here that I'm not sure we've covered, and then we'll go to those on the line. Will the recommended pause on J&J vaccine lead to the closure of any mass vaccination sites? No. The mass vaccination sites, by and large, have Pfizer and Moderna. For instance, it shouldn't cause any issue with the Cardinal Stadium mass vaccination site that we opened yesterday. The Kroger sites are going to be open for a little longer, and then we're pushing them out to more brick and mortar. Again, those are primarily Pfizer and Moderna. And just about everything out there is Pfizer and Moderna. This is going to impact independent pharmacies, which were helping us on the J&J. We're going to work with them to try to make sure that if this pause goes more than a couple days, we can get them supplies over time so that they can meet individuals in their communities. It's going to require a pause in our vaccinations in our corrections institutions, which were going really well. We certainly haven't seen any side effects there. It may cause a pause in a couple of outreach pop-up clinics that may be scheduled around the state in the next couple days, or depending on how long the pause goes. Remember, we also have programs like Louisville's using Johnson & Johnson to help vaccinate the homeless because you don't know the next time you're going to see them. Those types of things are going to be paused. And it's tough because this is some of the hardest to reach populations, and J&J has been a really popular vaccine, which is good. Again, I think we're going to work through this. I think it's going to be deemed safe and effective, but we're going to pause until everybody knows how to treat these very rare, what appear to be very rare complications that happen with just a few people. Okay, what should Kentuckians with appointments for J&J do? Your appointments, if they are more than 4 or 5 days out, keep them for the moment. We will see. We should have more information tomorrow once they meet. If it's today or tomorrow, probably the next day, it's not going to happen. J&J can't be administered during that time. You should contact that provider, though, and see if they have an alternative. We certainly, in many areas, have a lot of the other two vaccines available. Yesterday, we talked about Cardinal Stadium, 4,000 plus. The Kentucky Horse Park, 1,000 plus. Those are all Pfizer and Moderna. King's Daughter and their 2 locations in Ashland and Grayson in Carter County, Pikeville Medical Center, going out west. Again, a lot of good vaccine out there. We are working with all of the facilities that just have J&J, but we learned about this morning. So we are dealing with it in real time. Do I think that some who are supposed to receive J&J might not come back if they now have to receive 2 appointments? We hope not. But this is a curveball we're throwing. So we're going to work with it, right? We're going to make sure that we've communicated with all those individuals. If it's ruled that J&J is still safe for them, they'll have that opportunity in the future, but otherwise we have these 2 others. Again, we want to make sure we get everybody vaccinated. Department of Corrections, again, we think that we're not going to have any issues coming out of that, especially with the populations we've vaccinated. Almost none of them fall into what we believe are the at-risk group, but we're going to pause until we know. To Kentuckians who received the Johnson & Johnson vaccine, you're going to be okay. You're going to be okay. With a 1 in 550 chance of dying from COVID, or a 1 in a million chance of maybe having this complication, where there's only 6 in America, you're going to be okay. But make sure that you watch for the symptoms. If you are less than 14 days out from when you got the vaccine, watch for those symptoms. If you have them, go see the doctor, right? Go see the doctor. The doctor's going to know the type of treatment for this. And that information's getting out right now. That's one of the reasons for the pause. If you're past 14 days, you're fine. At least from what we know right now, you're fine. Okay, with that, we'll start with Alex Akisto from the Herald Leader. If you'll just let us know if you want me or Dr. Stack, we'll accommodate.
Thanks, Governor. So you said that very few of the state's total doses are Johnson & Johnson doses. Could you give a more ballpark figure? I think nationally, the Biden administration said 5% of the shots administered are Johnson & Johnson. Is it along the same lines in Kentucky? And also, you mentioned some of the areas where vaccinations may be paused. Is the goal to swap those Johnson & Johnson doses out for Pfizer and Moderna, or are you going to wait and see first?
So, Steve, our percentage about what the national is?
We got about 210,000 doses of J&J shipped in the state. It's going to be the same as
So Dr. Stack and I were just talking. It should be the same as the national, but we had one of our bigger shipments last week, a significant amount of which may not be administered yet. So from actual shots in arms, I would say we are probably a little south of the 5% nationally. But when they put out that figure, again, they're pushing it out per population. And the J&J, they have been committed to pushing that out through all channels per the population. So we think we should be right at or a little bit less. Now, for the facilities that mainly just received J&J, obviously they're important to us. We want them to be able to vaccinate. We do need a day or so to figure out, especially tomorrow when they meet, how long the pause is going to be. If the pause is only going to be 3 or 4 days, shipping next week that other type of vaccine isn't going to be helpful to their program, how they have it set up. If it's going to be longer than that, yes, we will work with those options. We know that everybody has a niche or a means, a group that they can reach that others can't. So we'll be working with all the providers to make sure, again, if this lasts longer than a couple of days, that everybody has the opportunity to continue vaccinating. Debbie Yetter from the Courier-Journal.
Hi. So to follow up, do you know how many doses of Johnson & Johnson Kentucky has received since it was approved, and how much of that's been administered?
So give me that number again, Steve.
So we've probably had about 210,000 doses received in Kentucky.
So we've probably had about 210,000 doses received in Kentucky. That doesn't mean they've been administered. That's something we'd have to drill down a little bit more. We got 60-something thousand of those 210,000 last week. So you are south of that number. We're probably at least 10%. At least 10%, we would guess, south of that number the 210,000. But we'll have to drill down again, just getting it this morning. And we'll have to do that by location to get that specific number. But if you look at 200,000 or less out of what I think is about 1.6 million first doses that have been out there, again, and when you add the second doses on top of that, we'll be south of 5% of the total doses that have been administered. Stu Johnson from WEKU.
Yes, thank you, Governor. Obviously, you've mentioned more than once about the 1 in 1 million chance at this point, it looks, in terms of this concern. Are you still, I guess I'll say, concerned of the impact this could have on generally on getting shots, hesitancy increasing because of the news?
Yeah, this doesn't help. I've pledged to be transparent from the very start. When we're facing something good, bad, or ugly, this doesn't help. And our goal is going to have to be to communicate and communicate and communicate, especially with those that may have been leaning towards getting vaccinated. If it was the J&J, what does this news do to their psyche or where they are? Again, I think that we'll work through this. I think the vaccine will be available to them. I think it will be very safe. And the other thing that we've got to do is educate people on the relative risks of getting and or dying from COVID. Because remember, there's a lot of nasty things that happens when you get COVID, and they can persist. And we've even talked about some cognitive long-term impacts that we're seeing. The risk of dying is so much greater from COVID than getting this clot from what we've seen right now. We're, again, just going to have to continue to push that education out. But no, this doesn't help. And the CDC and the FDA is doing what they think they have to. We're all a little concerned about the risk of dying from COVID versus just 6 people out of 6.8 million in the United States and the impact that this may have. But listen, we faced difficulty before, and we've always pushed through it, and we're going to do it here as well. Jess Clark from WFPL.
Hi, Governor. So it's from my understanding that the Johnson & Johnson vaccine was particularly helpful in rural communities that don't have, Walgreens, or that don't have, access to the Pfizer and Moderna. Are you concerned that this pause could impact those communities more significantly than others that have access? And if so, kind of what does the plan look like to get other vaccines to those pharmacies if this pause is extended?
So I think if you look at our map right now, where we are, having extended to all Kroger's, having the federal pharmacy program supplying things other than Johnson & Johnson to pharmacies everywhere as well, the federally qualified community health centers, that we now have Pfizer and Moderna everywhere. And we read out on Mondays and Thursdays where there are 1,000+ doses, 1,000+ appointments. And there's 1,000+ appointments within a 45-minute drive at this point of just about everybody. So there is no longer a overall access issue, but there are populations that have been harder to reach. Some urban, some rural, some where we have other barriers, transportation. And so I don't necessarily think it's just a rural. I think it harms us in reaching populations, any population where we don't think we can get the person back a second time. So I really think there's subsets in both. But we definitely have the network right now to where if you were going to get J&J in the next week anywhere in the Commonwealth, we can get you a Pfizer or Moderna. There's, Dr. Stack just said the same. There is plenty out there. Carolina Buszczak from WLEX.
Hi, Governor. I believe my question would actually be better for Dr. Stack, if you don't mind swapping out.
I take no offense.
Hi, Dr. Stack. I know a lot of this information is still developing and we're just learning more about this. I know you went over how low the risk is, but I believe they're saying the 6 people out of the 6.8 million that have developed this rare blood clotting, they are women. Is there a reason for that, or is this information we're still learning about? Is it too soon to have answers about why this may be happening?
Well, thank you. So we are still learning, and I listened to the FDA call like others and CDC call like others did this morning. The reason I suspect that they flagged this and have inserted a pause is that there are similarities between what they're seeing in these instances with J&J is what they saw with AstraZeneca in other countries around the world. Now, we're not using AstraZeneca in the United States yet, but the concern is that this condition, this cavernous venous sinus thrombosis condition, appears to be occurring just in women and just in women roughly of childbearing age, 18 to 48 years of age. And so when you find a pattern like that, and again, I want to emphasize what I said in my earlier remarks, we have in place really robust surveillance systems to look for these very uncommon, very rare instances to find it. And it's very reassuring that 6 people out of 6.8 million plus people is like finding needles in a haystack. Now, every needle is important and every person is critical. But in this case, they found it quick. And when they saw any similarity of a pattern with what they saw with AstraZeneca, they inserted a pause, and now they'll look at that data. And as the governor said, it's relative risk you have to determine. There is no risk-free choice in life. There's always risk. It's a matter of balancing the risks and the benefits. And in the case of AstraZeneca, after extensive analysis, they found that the benefits far, far exceeded any potential risk. But if they can recommend that the vaccine should be used or not used in certain populations and lower risk further, those could be actions they'll consider. And as far as the mechanism for what's causing this, they have to explore that further. There's a different pattern here. You have the blood clot and low platelets, and it's kind of a unique thumbprint for this particular occurrence. And I withhold for myself any speculation. We'll let the experts look at the real data and then kind of advise us more in the day or two ahead.
All right. We got about 5 more minutes. We'll answer as many more as we can. Jenna Cisneros from Local 12.
Good afternoon, Governor. Given the fact that the CDC is reporting just 6 cases, are you concerned that this pause could maybe be an overreaction?
I'm concerned that if there are not more cases out there, that the hesitancy coming out of the pause could potentially outweigh the need for it. But this is how they work. This is how the CDC and the FDA work. They watched what happened with AstraZeneca. There were more cases out there. And I think the compelling reason that they've given is needing to educate our healthcare providers out there how to treat these clots. I mean, they are going to happen in more people, it would appear, though it looks like really rare. But if the information hasn't gotten out to all of our doctors, nurses, et cetera, that if you treat this clot the same way you treat other clots, the person's not getting better, that you need to treat it in this separate way. I think a couple days to make sure that we can help that person that has that reaction is understandable. So again, we're going to work through this. We're going to make it through this. We're going to make sure we get the vaccine out to everybody. But there are 2 others out there. Go ahead and sign up for them. Melissa Patrick, Kentucky Health News.
Hi, Governor. Is there any plan to do any sort of outreach to the Kentuckians who have received the J&J to let them know specifically about the signs and symptoms to look for, but to also to be proactive in their healthcare so that when they see their provider that they can say, hey, make sure you treat me correctly?
Well, we're going to be working primarily with the providers that provided those vaccines, which is the first place that those individuals are going to call. We're working through those protocols right now. Haven't learned about it this morning. Haven't just gotten through the CDC press conference. But we can use your help, obviously, and I know that the media wants to educate everybody out there on what they ought to be looking for, which again, Dr. Stack went through, but also to stay calm. That if you've gotten first of all, if you've gotten Pfizer, Moderna, and you have the low-grade fever, the headache, that's normal. It has nothing to do with any of this. None of this is related to Pfizer or Moderna at all. If you get J&J and on the day that you get it, you have some of those things, again, that's not what we're seeing through this. This is a pretty severe reaction, again, that's occurring almost a week after that we just got to make sure that individuals are prepared for. But we're going to learn more tomorrow, just like everybody else when we watch that meeting. All right, Jose Neil Donis, Aldea in America.
Thank you, Governor. Hesitancy to get the vaccine is a problem, especially in harder to reach communities. Now with the JJ vaccine suspension, that hesitancy might be increased, but be more. Would you consider, or are you able to get only the Pfizer or Moderna vaccines for Kentucky?
So if, first of all, Jose, you're right in that the hard to reach communities, J&J was almost tailored for. You only have to get people one vaccine, and with more transient communities, people who are moving around, maybe following work. It's again, in many ways, it appeared to be the perfect vaccine. We believe after a couple days or a week, again, we're going to get the news that this is safe for just about all populations. But it will increase the hesitancy. Now, for all of those populations, yes, we can get you the Pfizer and Moderna vaccine. Actually, we can get everybody who wants it the Pfizer Moderna vaccine in the next 4 to 5 weeks. That's the way it works in the supply we have. So whether that's some of the communities we've been doing pop-up clinics in or others, it's there and it's pretty close to your community. We're now in so many different places. So we'd highly encourage everybody, get on kycovid19.ky.gov, call any of the numbers that we have. We'll put up on social media. We can get you Pfizer and Moderna right now. But remember, less than 1 in a million chance right now of developing this issue with the J&J vaccine, 1 in about 558 chance of dying of COVID. We just need to make sure, again, that people see the risks, that we communicate and that we educate the best we can. We can do one last question. Drew Gardner from WLKY. Then we will answer everybody else's questions if you'll send them to us in writing.
Good afternoon, Governor. Talking about the hesitancy, now that you're in this final push to get the last vaccinated, you have a surplus of Moderna and Pfizer. Are there any plans statewide to make direct outreaches to try and get to those people who have been hesitant, and that this might push them fully over to the side of, I'm not going to get this?
Yeah, so we've been doing a lot to get to those that have been hesitant and or to make it easier. We've got some mobile units and we're going to be expanding those. We're also moving a lot of our mass vaccination sites out into more brick and mortar sites. We're adding 100 plus across Kentucky. The idea, Drew, being that we make it a part of your daily life instead of something that we have to pull you to a vaccination center. So you go to get groceries. No matter where you go to get groceries, you can get vaccinated. We hope when you go to any doctor's appointment in the near future, you could get vaccinated there. You go to get your prescription filled at any pharmacy in your area, you can get one of these vaccines. Places that you routinely go, that it can be a part of your natural rhythm. Now, I will say those that are hesitant, I'm not even sure we're there yet in our rollout. I think we're more to the group that's casual, that will get it if it's easy or if it's a part of their daily lives. Is this going to make it harder on those who are hesitant? Yes. Yes, it is. This is just another curveball or difficulty thrown to us by COVID, but we'll work through it. We built a testing system from scratch where anybody and everybody can get tested in any part of the state. We've got a strong 3-month plus supply of PPE when we used to not be able to buy a single N95 mask. We've got at least 2 approved safe and effective COVID vaccines that are eliminating death and serious illness basically to everyone who's taken them. And we're seeing our death numbers and our case numbers plunge because of it. So we can do this. We just got to push through. All right, everybody, stay strong, stay calm. We're going to get through this. We're going to get through this together. We knew that there would be other challenges. We're going to face them. We're going to beat them. We're going to win.